Endodontic retreatment. In most cases, teeth that have been treated endodontically will last as long as natural teeth. However, patients continue to experience sensitivity to heat and pain in some teeth. This can happen immediately after treatment or years later. If the tooth fails to heal and the disease process continues or starts again, it can be retreated and have a second chance to heal. Root canal treatment may fail for a variety of reasons. Abscess did not heal. Narrow or curved canals were not treated during first treatment. New decay forms along the filling material. Complicated canal anatomy, such as supplemental canals, went undetected. Restoration was not placed soon enough after treatment. Restoration became loose, cracked, or broken and exposed the teeth to new infection. If the patient feels pain and discomfort with a tooth that has had root canal treatment, she or he should return to the endodontist and discuss treatment options. The endodontist will reopen the tooth to gain access to the root canal. This can be difficult to accomplish because the tooth may have a crown, post, and core material, and all these have to be removed to permit access. After removing the restorative materials, the endodontist can clean the canal and carefully examine the inside of the canal. The problem should be supplemental canals and or unusual anatomy. After cleaning, the canal will be filled and sealed and a temporary filling will be placed. The patient will then return to her and his general dentist for the final restoration, which may include a new post, core buildup, and crown. Sometimes the endodontist may believe that the problem is at the apex of the tooth and will recommend an apicoectomy discussed later in this chapter. Pulpectomy. A pulpectomy is the removal of all pulpal tissues beginning in the coronal portion of the tooth and terminating 1 to 3 millimeter short of the apex in the root canal of a tooth. This procedure is used in the treatment of deep caries in permanent teeth. Pulpectomy is the first stage of root canal treatment. Cleaning and enlarging the canal usually follow. Pulpotomy involves removing the pulp in the coronal portion of the tooth, leaving the pulp in the root canal intact and vital. A pulpotomy is indicated for the following: primary teeth with pulp exposure, treatment in emergency situation where there is pulpal exposure, teeth with deep carious lesions, apexogenesis, treatment of vital tooth where the root is incompletely developed, fractured anterior teeth, surgical endodontic. Endodontic treatment has a high rate of success, but situations arise in which surgical endodontic treatment is necessary to prevent extraction of the involved tooth. Surgery is performed in the area surrounding the roots of the teeth. These surgeries involve a facial surface incision through the tissue to expose the underlying bone. An opening through the alveolar bone is made to expose the root area where surgical endodontic treatment is performed. Surgical technique include apicogenesis, root amputation, and hemosection.